I'll cut it down to Mr. R. Here's my email address if you need my email, and then my website. I see some of you have already been taking a look at the website, helpmemrr.com. That's what it is. And using that website, what I really do is provide you with a bunch of pictures. These pictures are there for your help. Now, as I was just speaking to this gentleman before, we were saying, you know, I don't want to label them for you just because I don't want to spoon feed you the information. It's your job to go and make sure you're taking these pictures and, you know, print them out and make your own labels. So it works that way. But for this particular practical review, I will have labels. And I will provide this PowerPoint to you. It's already on the website. It's under the Practical One place. It says click here for the PowerPoint. It's pretty big, so it may take a little bit of time, and actually that's what I'm waiting for right now. I'm kind of stalling. I'm doing a pretty good job of it too. All right, so we have it set up for over here. Now, a little different this semester. We actually have models. Now, we heard what you said. For those of you who took the AMP1 practical review with me, we heard what you said. We actually are starting to get more models. On top of that, I have slides. Now the slides, what I will be able to do is project the image onto the screen. And after that, we can take a look at each one. I also have pictures of each slide. I have all of this stuff on that particular PowerPoint. There we go. Do you want to start? No. So, for those of you who are just coming in, please make sure that you go to the side, sign in on one of those computers. And here we go. This is the practical review by Professor Rodriguez. Of course this thing doesn't want to work. Technology. Gotta love it. If you want to look at the PowerPoint, go to the Practical One, and click on the picture. You have to click on the picture. Okay? So this is the first kind of model that we deal with. Lab 1, we spoke about the eye. Now, there are a lot of questions that can come about when we're talking about the eye. Now, we can talk a whole bunch of exterior. We can talk about a whole bunch of interior. Now, understood that this particular picture may be cut off a tiny bit, but you can see most of the things. Now, see over here, you have some sort of brownish, reddish kind of color. That should right away trigger to you to say muscle. You have one over here, one down here, one over here, and one up there. This is the normal kind of what we're thinking about when we think of eyes. We see the white portion, then we have the colored portion, and we have that hole in the middle. That colored portion is called the iris, and that middle portion, that hole, would be your pupil. On this side, now I labeled it as your medial rectus muscle. I'm going to show you how to realize that it's the medial rectus muscle on a couple of different pictures. So this would be medial. What does that mean? Well, medial, if you go back to the tricks that I talk about in AMP1, if you take your hands and go like this, right? You have an M and an L. Medial points to the middle, lateral points to the outside. So medial rectus muscle has to be a muscle that's going to be pointing in medially, this way. Lateral rectus muscle will be pointing this way. Superior rectus muscle will be on top, and inferior rectus muscle will be on bottom. Now, go back to those terms from AMP1. Remember that list of body landmarks and inferior, posterior, dorsal, ventral, those terms that you remembered from AMP1. will really help you with a lot of the things that we talk about in A&P2. This thing isn't working. So, as I showed you, I said I was going to show you a better picture. Well, take a look at this right here. This is the top of that particular eye. You have your superior rectus muscle on top. You have your lateral rectus muscle on the other side. What would this be then? This would be medial rectus muscle. You have your pupil again. What's the white part of the eye? The sclera. So the sclera, you think white of the eye. Now, how I get to remember it is because of a fun aspect that I had of my life. I had scleritis. We've all heard of conjunctivitis, right? The conjunctiva is that thin layer, right? Well, I had scleritis, the inflammation of the sclera. Ouch, that hurt a lot. So if you think sclera, the white portion of the eye, think Mr. R got scleritis, you think that's the major portion of the eye that's basically making that white color. Whenever somebody draws a picture of an eye, they have that white portion and then the iris and the pupil. That's a common picture of the eye. So all this down here would still be part of the sclera. Now this brown, very vascular portion towards the back, that brown, very vascular portion. How we can tell it's very vascular? Because it has these red and blue vessels. These red and blue vessels running. Brown vascular portion would be something called the choroid. The choroid. Now these pictures are the exact pictures that I have on my website. I just added in my arrows. On an inside view, you have the optic nerve. You have your ciliary processes. You have your ciliary muscle. And your lens. Your lens is that thing that's going to be like a camera. If we're looking at the camera that we have set up right over here. With that lens, as you're zooming in and zooming out, that lens is trying to focus. Our lens does the same thing. Our lens will try to focus on a particular area, further away, closer up, by trying to focus. And the help of our ciliary muscles to pull and push and pull. And then over here, if you can see where the arrow's pointing, where my arrow is pointing, this area right here, my apologies for these particular PowerPoint, sign in right over there. For the PowerPoint not being able to reach all the way to the top, but that top part is your cornea. Your cornea. So if we go back to another picture, this over here is your cornea.
It's right next to the pupil?
It would be actually like a covering. Yeah. So it goes on both sides, but what they did for these particular models was cut it in half just so that you could see both sides. The lens itself is going to be that glass or plastic thing inside, and the pupil is the actual hole. So make sure you're paying attention to where these pointers are getting pointed. If it's pointing to a hole, it's a pupil. If it's the actual glass or plastic piece, it would be the lens. Okay? This is another great model of the eye. With this model, we show a couple of these accessory structures. Now we have the whole eye. This is where your iris would be in here. You'd have your pupil. Your lens is here. This also shows a couple of different things. Number one, it shows the medial rectus muscle. It shows inferior, superior, and lateral rectus muscles. Now, as a little tip, I know personally when I teach this course, I ask to tell, is this eye left or right? Now, for those of you who have ever joined me for the Anatomy 1 practical review, I do this trick with my hands. And I have the bone and I put my hand on either side of the bone, and I say, which way is this particular part pointing? And you can tell me which eye it is, or which bone it is. This one I'm going to do with the eye. What's the name of this thing right there? Starts with a superior, ends in an oblique tendon. Superior oblique tendon. So the superior oblique tendon, what that does, this area right here, is it attaches inwards. So as a kind of rule, the way that I usually do it, I put my hand on either side of the eye, and I ask, where is the superior oblique tendon pointing? For this one, where is it pointing? My right hand or my left hand? Right, so this is the right eye. Now that will work for, oh, I'm blocking it on this one. This one will work for this one also, but the superior oblique tendon is pointing this way, all right? So if it's coming this way, put my hand on either side, it's pointing to my left hand, so this is left eye. The left eye. Depending on who your teacher is, you might be asked for left or right. Now, having this particular model, it's a lot easier because you can see how the eye is going in. But if you have the eye by itself, look at the superior oblique tendon, hand on either side, which way is it going? But it has to be the anterior view. Anterior view, not posterior view. Okay, so we have excretory lacrimal ducts coming off of this lacrimal gland. We have the nasolacrimal duct going down. We had the superior oblique tendon, superior rectus muscle, medial rectus muscle, inferior rectus muscle, lateral rectus muscle. I'm trying to think if I can find anything else that's good. And a Diet Dr. Pepper in the back. Another look. You have the ciliary muscle, which is going to be holding in that lens, right? We have the cornea. We have our iris. And back here we have our vitreous humor. The vitreous humor. Are we going to be able to see aqueous humor here? No, unfortunately not. But remember when you were doing that eye dissection, when you made that first incision, that first kind of juice that came out, that was your aqueous humor. Then you got to the jelly stuff in the back, and that was your vitreous humor. So, ciliary muscle, iris, cornea. You can even see over here, this would be lateral rectus muscle. I'm trying to pull as much as I can. Ooh, fovea centralis back here. I have a better picture of it, but I'm just trying to pull out what we can do. Okay.
You have to say that macula lutea or
In macula lutea, it depends on who your professor is. If they say fovea centralis in macula lutea, make sure you're putting that whole thing in, okay? Because essentially what it is, it's a dot in a dot. And they basically work hand in hand. So since we don't have a particular picture that has both, we say fovea centralis in macula lutea. Back here, your retina. When you go to the eye doctor and they look at inside your eye and they're seeing to make sure that everything's okay, they look at your retina. They take a look at the optic disc in the back. And if everybody just takes their attention to right over to the screen over here, you see your fovea centralis up here. For some reason, like I said, this is not showing up pretty well. So right over here is the fovea centralis. Blue are for veins, red are for arteries. I'm not sure if they go over that, but if you if you have like a degenerative disease, one of eye problems, if you have an increased, like a dilation of these particular vessels, it increases the pressure in the back of the eye. That's one of the problems that can happen. That's why the eye doctors are looking in the back of your eye to make sure that everything's okay. And then the optic nerve is that portion coming out. Okay. All right. Any questions on the eye? The eye is kind of one of those structures you just have to go over them, go over the structures over and over and over again. Yeah? Okay. So moving on to the ear. That classroom looks familiar. Now the ear, basically we break it into outer, inner, and middle ear. This first part over here is your auricle, or called your pinna. If you've ever seen a doctor write down a prescription, especially for something like an ear infection, PO means per oral for the mouth. PA means per aural for the ear. So we think auricle or aural for the ear. Then you have your external auditory canal. What bone is that? The external auditory canal of the, oh, I'm upset. Yes, high five, one of mine. Of the temporal bone, or external auditory meatus of the temporal bone. I know particular professors that will ask that, so make sure. Just because you learned it in AMP1 doesn't mean you have to not know it for AMP2. So, as you get your sound waves in, your cone, basically your ear, is bringing in all these sound, going into the external auditory canal, and it passes to the tympanic membrane. Common name? Eardrum. Your eardrum. Your eardrum basically is going to have that message come along. Then you have your three tiny bones, your ossicles. We will talk about the ossicles. I have a nice picture of them, the three different types of ossicles. Those ossicles come along and are going to go and take a mechanical message, which is just movements, and send it through fluid called lymph in your ear. And then that's going to make an electrical message so that your brain understands it. Hearing is really, really, really an interesting concept because you're going from sound waves to go in to a mechanical energy to then going into an electrical energy so that your brain understands what's going on. It goes in, you see these semicircular ducts. Now, for my class, what I see is this particular area, they look like straws. So since they look like straws, there will be the ducts. The canals go around them. I had one of my students last semester, and I give them credit now, but next semester I get to take all of these things, you know, all the ways that people remember things. I usually give them credit for about a year, and then I take it. So they said the ducks swim in a canal. The ducks swim in a canal. Duck, like whack, whack, right? So the ducts are inside of the canal. I like that. So the actual straw-looking things would be the canals. Now make sure that your professor actually says it the same way. I would make sure that they do that because, once again, what you have to remember is that I'm not giving you this practical. Your professor is giving you the practical. So you need to make sure that you're going to be on the same page with them. This is just supplementary. Okay, and then you have your eustachian tube going down. Now you could take this particular model and break it into the smaller parts, What I like to do is take the bigger models, and you'll see that they're basically the same thing. But let's go on to a bigger model. The ossicles. The stapes, that's kind of one that's really, really easy just because it looks like a stirrup. If you think about like cowboys and stirrups, it looks like a stirrup. It looks like you're going to put your foot in that and get ready to ride a horse or something. The malleolus, or the malleus rather, sorry, it's going to be like a hammer or a mallet. Have you ever heard of a mallet? It's like. And then finally, the incus, they say the common thing is it looks like an anvil. And I don't know if you remember, but like go back to Looney Tunes, right? Remember Looney Tunes where Wile E. Coyote used to get the anvil dropped on his head from the Roadrunner, right? That's what they're talking about, anvils. And it actually does look just like that. So we have our stirrup, which is the stapes, stirrup, stapes. We have the malleus, that sounds like mallet. And then we have our incus, which is going to be our anvil. Now these three bones, it takes the information from the tympanic membrane and they're going to move. And essentially, since this stapes has this flat part on top, it's going to hit a particular area called the oval window. And as it hits this area, it takes the fluid inside the ear and starts moving it around. And as the fluid inside your ear is moving around, the tiny hairs pick up these movements. And what we'll notice for smelling and for hearing, these cilia, as they move, they create electrical impulses. And those electrical impulses go to your ear and say, I'm hearing. Now, all of this, which is interesting for us to think about right now, all of this is happening as I speak. As I'm talking to you, all of this is happening right now. Just so that we can understand each other. Excuse me. We then go to our next portion. We have underneath here is where the oval window would be. We have the utricle and saccule. How I remember it, U-S, us, utricle on top, saccule on the bottom. We have this lymph all inside these semicircular canals. The lymph inside these semicircular canals. This is the canal. This is the duct. Remember I told you if it looks like a straw, it's going to be holding something. Inside, the ducts swim in the canal. The ducts are inside that canal. We have three types. We have our superior, which is the one that looks like if you were holding a shopping bag. If you were holding a shopping bag, that would be the superior semicircular canal. That one's like this, so you'd hold it like that. Posterior is going to be like a mug. If you were drinking a mug of coffee or something, that's the one that you grab like this. And then your lateral semicircular canal is going to be this way. That would be pulling a door. Ah, you know when you pull a door open? I just thought about that right now. It's pretty good. Pulling a door open, like this. So we have superior is going to be holding like a shopping bag. Posterior is going to be like a cup. And lateral will be like holding a door or a shopping cart. So now you have your information going down into this portion that looks like a seashell. What is that called? Cochlea. The cochlea. The cochlea is this whole big portion that looks like a seashell. Now, we do go into depth of which portions of the cochlea these are. But what we should see is this kind of turning motion goes into an area called the cochlear portion of cranial nerve 8. This comes out, and it's going to go to your brain. What is this whole thing called? The vestibule. The vestibule. So the utricle and saccule has these yellow things coming off. If your professor asks you, those are the vestibular portion of cranial nerve 8. Vestibular portion of cranial nerve 8. This is the cochlear portion of cranial nerve 8. They come together. That's why it's called the vestibulocochlear nerve. Vestibulocochlear nerve, because it's coming from both parts. Now, inside, as I said, this is going to be turning and turning and turning, and we have these 3 things inside. Oh, before we get to that, a better view. You have your oval window. What fits right in there and starts hitting? The stapes. Good. So now we have our semicircular canals. This one like a mug, posterior. The one like opening a door, lateral. The one holding like a shopping bag, superior. We have our utricle and saccule. Now if you take a look inside, we have this tiny little, it looks like if I were to take my thumbnail and put it in a little bit of white paint. And then I took my thumbnail and went like this. That little tiny portion, that's the organ of Corti. The blue is going to be your cochlear duct. Now, yes, it's hard to see here, but let us go in a little closer. There is another model, and I hope that your professor went over it. It looks like this. Now, with this model, you really get to see the different types or the different parts of that cochlea. As it's turning around, we have the scala tympani, the scala vestibuli, and the cochlear duct. Those are 3 basic areas. And we have these membranes that separate them. The membranes that separate them, first one is the basilar membrane. Think of it like basement, like on the bottom. It's going to anchor. It anchors in where this organ of Corti is. So basilar membrane, organ of Corti. These organ of Corti has these little hairs on it. Those hairs help us do what? Transmit the... Huh? Sound waves. Okay, I couldn't hear it. My organ of Corti wasn't working so well. These little tiny hairs, as they move, they let the electrical impulse go to the head. Right? Organ of Corti, we have our tectorial membrane, which is on top. This is your organ of Corti. The tectorial membrane is like this. So basilar membrane, organ of Corti, tectorial membrane. And then you have on top, which is going basically separating the scala vestibuli to the cochlear duct, would be your vestibular membrane. Vestibuli, vestibular. Vestibuli, vestibular. Red is a... What kind of blood vessel?
Artery.
Artery. Blue? Vein. Nice. That's going to help us when we start going on, especially when we do for the second practical, talking about circulatory system. Okay. Any questions for the ear? No? All right. Smelling. For the nose. This is a great picture. This particular model shows so much in this tiny little thing like this. I wish that we can have this model. We don't. But, so, if you remember from AMP1, the ethmoid bone had these two things over here, superior and middle nasal concha. And then inferior was basically by itself. But these three bumps, now depending on how your professor asks it, they might just ask for the nasal concha in general. But if they're being specific, the one on top is superior, the one in the middle is middle, and the one on the bottom is inferior. Superior, middle, and inferior nasal concha. These things that look like hairs, in fact they are. They're the olfactory receptors with your cilia. Remember I said cilia is going to help, the movement of that cilia is really what helps us make that electrical impulse go into our brain and understand what we're doing. As we're breathing in, number one, cilia is going to help us warm up the air, but it's also going to help us with that impulse from smell to the brain. We have the cribriform plate. Oh, I spelled it incorrectly. I spelled it incorrectly. How do you spell it? I did that on purpose to make sure that you were paying attention. It's cribriform. Cribriform, R-I. Cribriform plate of the ethmoid bone. Cribriform plate of the ethmoid bone. That particular portion is essentially, it's here, and then you have something sitting on top. It's a bulb of some sort.
The olfactory bulb?
The olfactory bulb. Cranial nerve 1. So the olfactory bulb comes, these receptors head through that cribriform plate. Remember, if we remember the cribriform plate, they had the crista galli and the cribriform plate on either side. That cribriform plate actually had these tiny holes in it. It looked very porous, and that's because these receptors are going to be coming through. Now, as it then goes up the bulb through the nerve itself. We call nerves in the central nervous system tracts. So the olfactory tract goes from a bulb to a tract. T-R-A-C-T. T-R-A-C-T. So that olfactory bulb going into the olfactory tract. You have your olfactory receptors coming down, your superior, middle, and inferior nasal concha. You also see the opening of the eustachian tube, which is pretty cool. When we go into respiratory system, we'll be able to label these things. Don't be surprised. How many of you have Professor Ree? Ree, or Dr. Ree rather, sorry. Don't be surprised if she doesn't ask things like, what is this? Or, what is this? Just because it's an AMP1 doesn't mean that you don't have to know it. You do have to know it. So this would be palatine process. Oh wow. I would look at that again. What's this? The maxilla. Yes, my student's getting it. Don't be surprised. Okay. All right, any questions about smelling? No? Okay, moving on. These are questions that I kind of just put them in. I'm not sure if people will ask them, but I can. They can definitely ask these questions. Questions like, what endocrine gland is this? Pancreas. What endocrine gland is that? The adrenal glands. That was all I could see over here as far as that. Oh, how about the pineal gland? Or the hypothalamus? Or the master gland? The pituitary gland? These are things that are definitely can get asked. Definitely. Okay. Now we'll go on to slides. Now this is a picture of a slide that we basically saw underneath the microscope. The pancreas. You see these tiny cells. You have lighter versions, darker portions. What I want to do is basically show you underneath the microscope. So you have these islets of Langerhans, which are this entire portion. And then each one of these tiny cells, these acinar cells, are going to make those digestive juices. Pancreas has two functions, both digestive and endocrine. The acinar cells are what's going to make those digestive juices for digestion. And then the endocrine function, we're going to talk about, where you talk about your alpha and beta cells creating insulin and glucagon. So how you tell this one, they are basically look like little crop circles. They look like little crop circles on the slide. 1, 2, 3, 4, 5. And each one of those little crop circles are the islets of Langerhans. That's even fun to say. Islets of Langerhans. You guys are really intense. All right, let's go. So let's, I believe I have a, nope, that's a thyroid. See if I can grab a pancreas slide and put it up. So what I'm doing is essentially, oops. This is tough to do, huh? All right. So this is under scanning power. Right away, what do you see? These crop circles that I'm telling you about. Those crop circles will be your islets. Now let's go in a little closer. It's not working as well as I wanted it to, but you see your little islets. It's the first time I'm using this machine too. Looks okay though, looks good. Now the difference between looking at this pancreas and the thyroid is really evident. It's really evident. So let's go on to our thyroid gland. Oh, I just had the thyroid. What kind of cells should we be looking for in the thyroid gland?
Did you say what type of hormones?
What type of cells? Well, let's make it a little easier. I'll show you this picture first. Thyroid tissue, things you should know. Simple cuboidal epithelium. That's the cells that I was talking about. Simple cuboidal epithelium. Inside each one of these, you will find your thyroglobulin. You're right. Your cells outside the follicle, parafollicular cells, outside of the follicle. And then this entire portion is considered your follicle. So you have thyroglobulin inside, you have simple cuboidal epithelium all the way around. Your follicle is this entire portion, and the cells outside of the follicle, parafollicular cells. Notice, difference between these and pancreas, the big space in the middle. That big space in the middle. If you see that big space in the middle, right away you should think thyroid. Okay, so let's go back to my slide, which I don't see a lot of parafollicular cells, but I do see basically everything else. Okay, here we go. All right. So I'll keep it like this. This is a pretty big follicle. This entire thing would be your follicle. Thyroglobulin inside. You have your simple cuboidal epithelium all the way around. You have your parafollicular cells over there. Outside of the follicle. Para, outside. Follicle, or next to. So the difference between the two cells, you see that really, really, really big pink area inside the thyroid gland, or a thyroid cell. Okay, how about the pituitary gland? The I think this is working out better than putting it full screen. I'm going to do it this way. The pituitary gland. You have two parts. Anterior looks really, really, really condensed. Very condensed. Where posterior looks a lot more drawn out. Now, what I have seen is people see the pituitary gland and mix it up with testes. Make sure you don't do that. When your professor puts it on, most likely this is what you're going to see. A contrast between two sides. If you see a dark area and a lighter area, the darker area will be anterior, the lighter would be posterior. Pituitary gland. Okay. Ooh. It's okay. Do we have... We do not have pituitary gland. That's upsetting. How about the testes? Now the testes, this one is a little difficult, and the only reason why sometimes it's hard is to find these immature sperm cells. If you can find an immature sperm cell on this, that means you did a really, really good job. It's really hard to find that. So this particular slide was actually done very well. But what you'll see, you have your seminiferous tubules, you have your immature sperm cell, which would be inside that seminiferous tubule, and then you have these interstitial cells. Interstitial, between, stitial, talking about tissues. Between the tissues, there's these cells, interstitial cells. Between the tissue, there's cells, interstitial cells. And that's going to secrete testosterone. You'd see like an immature sperm cell here, here, here. Sometimes they get a little blurry like that. That's why it's, kind of hard to see. But like here, you don't see one. All this area immature sperm cells. Now, if your particular professor did not go over these slides, then don't worry about it. I'm just trying to cover everything. Okay? Just to go in a little deeper for the sperm cell, take a look at that slide. That slide is like perfection. That is perfection. You have the whole lumen, you have the immature sperm cell, you have areolar connective tissue going all the way around. You have certain cells undergoing meiosis. This particular slide is really, really great. Then you have your interstitial cells. This one, this is a keeper. I will have these slides for you. You can get the practical review that has all of these slides already for you, so you can use those. Okay? That's about it for slides. If you do need more slides, I do have a couple over here, but just for time's sake, I'm going to go on to male and female reproductive. Any questions on the slides? Okay, so male and female reproductive system. Now, the great part about this is that I have models. We never had models before, but now we do. So this particular model, I will, how can I do this? I'll just keep it up. I'll hold it, I'll show you guys here, and then I'll show you on the model itself. Now, there are a lot of structures for male and female reproductive system. It's not that the information here is very, very, very hard, it's just a lot of information. Now, the best way that I like to do this is the bottom up. The reason why is just that there's a lot more structures here than over here, and my personality is to get all the stuff that's hard done first and then go to the easy part. So we'll start off with the labia majora. The labia majora are these outside folds right over here. And if you go up one, you then get to your labia minora. Major, outside, minor, inside. Labia majora, labia minora. If you follow the labia minora upwards to this blue type of tissue, what you'll see common for male and female, we have homologous structures made up of the same type of tissue, same type of erectile tissue. This is the clitoris. Follow the labia minora upwards, you get this blue tissue right over here. That blue tissue is the clitoris. Now, there are two openings. Two openings. See, male reproductive system, only one opening. Female, two openings. One is the urethra. This is the urethra going up, and if you travel up, you would see the urinary bladder. Urethra going up into the urinary bladder. Urethra, bladder. Now, the second opening would be the vaginal opening. The vaginal opening right over here. The vaginal orifice would be here. The whole vagina is here. Now, if you head posterior, heading posterior, you get to this portion right here, which is your rectum, and you have the anus. Rectum, anus. Going up the vagina, we have this area right here, which is basically when you get to the uterus, where the uterus and the vagina meet, you have something called the cervix. Now when someone's saying, This person is dilated X amount of times, X amount of millimeters. What they're doing is they're saying, how big is this cervix? When the baby is being born, when someone is pregnant and baby is ready to be born, this cervix will dilate. The opening will open up. That makes sense, right? The opening will open up. And depending on how much this particular cervix is dilated, will tell how much time we have before labor occurs. I'm not sure if your professor will go over internal and external os. Yeah? Internal, external os of the cervix. Uterus is this thing over here. It's a pear-shaped organ that's basically in a bent position. The uterus is in a bent position. This right over here. And then coming off of the uterus, you have these tubes called fallopian tubes. These fallopian tubes wrap around, have the fingers called fimbriae. Did I label that? I didn't label it on there. But fimbriae. And then you have your ovary. Ovary will release an egg. The fimbriae, like little fingers, guide it into the fallopian tubes, pass through into the fallopian tubes. Fertilization will occur inside the fallopian tubes. And then if fertilization occurs, then you have the whole getting ready for baby process. This area right here, it's a piece of fibrocartilage. A piece of fibrocartilage that's in between your os coxae, called the symphysis pubis or pubic symphysis. And then mons, I think like mons, like mound, right? A little area of fatty tissue that's right here, right above the mons pubis. Yeah. It's just adipose. Oh. If you follow the labia majora down, and this is your rectum, this is the labia majora, basically this area right in between, the space in between where the pudendal nerve would be, that's called the perineum. The space between vaginal opening or urethra from here to here before you get to the anus, that's the perineum. Ooh, what's this? It's making an S. Part of the colon. Nice. The sigmoid colon. The S shape of that colon is the sigmoid colon. AMP1. A lot of fun stuff. Okay. The next model I do not have, but what I will do is I will put this here as a display if people want to look. This next model, you want to take a picture of that? Can you give it to me like, can you give me a little time? And then I'll come back and you can take a picture? Okay. Next model, a really, really nice model to show the parts of the particular uterus itself. We have the fundus, we have our myometrium, we have endometrium, we have our fallopian tubes, we have the fimbriae, your ovary, your cervix, the vagina. I don't know if Maybe your professor will go over ovarian ligament. This would be ovarian ligament. It's ovarian utero ligament. Just ovarian?
And the other ligament.
We'll go over it. If you want, me and you will go over it on the side, okay? For anybody else who needs to know the other ligaments as well, we can backtrack and I'll go over that also later. Okay? Now, moving on. You know what? Before I do that, we'll go to the ovary model itself. Now, this ovary model, what you should see, a couple of different things. Number one, we're all really just talking about this, the egg. Now, what happens? The egg is ready, and it's going to be basically ruptured out. After it ruptures out, the body needs to fix that area. So it kind of heals and creates some sort of like scar tissue. And this is what's happening. You have your ovum, right? You have your Graafian follicle, which is basically about to rupture. If we take a look at a ruptured follicle, see what happens? That's because this particular area ruptured, released your egg. Then you're going to have the beginning of these like scarring, and you'll have your corpus albicans and your corpus luteum. Now, how I tell the difference between corpus albicans and luteum, I think like albacore, like the tuna. White, the tuna is white, right? So albicans, albacore, whites. And then luteum, like lights, like if you have like a bright idea, sounds like bing. If you draw lights, they usually draw a yellow color to it. So luteum, lights, albicans like albacore. Now the difference between the primary and secondary follicle, it's just getting ready. So primary is smaller, secondary will be a little bigger, and then Graafian will be your big boy. If we think the term primordial, primordial is kind of like before. Before the follicle actually really happens, it's really small. Primordial follicles will be these tiny little follicles. Primordial, primary, secondary, Graafian. Forget about guys. We won't work with the guys right now. Let's finish up with girls. All right? So, we also have the required structures for basically your embryo models. This is primordial. This is before anything happens. I usually like to project this, and you'll get an understanding of how I see things. I see this as a little person, right? Eye, nose, mouth, hand, leg. I usually draw like a funny nose to it. It looks pretty good. But if we take this bit by bit, we see that 1, 2, 3, basically where our head would be, that's going to be the primordial brain, where the top of our head would be. A, B, and C. And the primordial nose would be this guy right here. Looks like a big honker. The primordial eye would be right here. Remember, we're thinking primordial like before. Primordial mouth would be 4, this thing right here. You have your branchial arches. Make sure that you're spelling that correctly. Branchial, not brachial, because brachial would be arms. And then here we have parts of the primordial heart. Seven would be the liver. 8, they look like little arm buds. And 9 looks like little leg buds. And then 10 would be this whole portion right here, which would be your vertebral column. Now, this is what happens before. And then we start going into the different weeks. We have 1 month after conception. You'll have your amnion. If you think about like amniotic fluid, when the baby comes out, it has that amniotic fluid, right? It's swimming around in that amniotic fluid. The amnion is basically the sac that's holding that embryo. You have this chorion, and from the chorion, we have this developing placenta. This is 1 month. Very, very tiny.
Wait, the yellow is the developing placenta?
This area right in here, that's attached onto the uterine wall.
Oh, the shaded portion.
Yeah. Yes.
Chorion on the shell or chorion is just the back?
This back area right here. Huh. Next, you start seeing your chorion, this darker area, starting to basically become less and less, but you see that the developing placenta is becoming bigger, much bigger. Because if you think about it, the placenta is going to be that passageway between mom and baby. You still have this sac in here, which is your amnion and the embryo. 14 weeks, notice that that chorion is gone. But we have a placenta that's developed. We have the amnion around, and then you have your 14-week fetus. And that's all the baby models that we have. Oh no, there's one more that I didn't take a picture of. I don't know if maybe your professor goes over the full baby model with the placenta coming off. No? No?
Yes.
Okay. So that's okay. All right. Now let's backtrack to the less important males.
Oh, shoot.
Wow. That's a lot of stuff. So, we take a look at our male model. Now this male model, a couple of different things. Once again, I'm going to start from the bottom up. This area right here holding the testes, this is the scrotum. The scrotum positions the testes away from the body in order to make sure that the temperature is dropped about a degree or two to make sure that optimal sperm production.
What is the appropriate temperature? 92 or is
It's I'll look it up for you. The exact temperature don't know off the top of my head. Scrotum. Testes are these things right here. You have your epididymis on top. The epididymis on top. And then it basically goes up to this thing over here called the vas deferens. This tube called the vas deferens. This group of vessels and nerves over here is called the spermatic cord. Now what I'll do is I'll go from testes, epididymis, around the vas deferens, into an ampulla. An ampulla, what I want you to think when you think of the word ampulla, think of like a bulb. It's a bulging of one area. So you have your vas deferens coming around. This area is your ampulla, which is this bulb. Then you go from your ampulla, your seminal vesicles secrete seminal fluid, and when the sperm from your vas deferens and the seminal fluid meet, it goes into your ejaculatory duct. So, seminal vesicles, ampulla, ejaculatory duct, meet in the prostate, which is this area right here, and enter into what we call the prostatic urethra. We break the urethra into three parts: prostatic, membranous, and spongy. So prostatic urethra is going to go through the prostate, goes down into membranous urethra. Now here, the bulbourethral gland, or the Cowper's gland, prior to this creates pre-ejaculate, which will make sure that everything inside that urethra, from the spongy urethra onto, from the membranous urethra to the spongy urethra, make sure nothing acidic is there, make sure that we clean out that area. Once again, the reason, males only have one exit. Since they only have one exit, it really has to make sure that that sperm, as it's making that travel, well, it can't die off. So that pre-ejaculate is going to help clean out that urethra.
Try to keep it as basic as possible.
Correct. Try to keep it away from the acidity. Also, you'll have things that will help neutralize the acidity of the vagina, because the vagina is very, very acidic, to make sure that no bad things will grow in there, any other microorganisms. So this entire semen is there to protect the sperm. So going through the membranous urethra, out the spongy urethra, through the membranous urethra, out the spongy urethra. There we see the muscles, the erectile tissue rather, that make up your, the penis itself. The whole shaft of the penis is made up of two types of erectile tissues. It's 3 cylinders. Now, I have this particular model, and then I have the model of the small penis that they have, that if you look in the back, you have the 3 erectile tissues. You have the corpus spongiosum, you have your corpora cavernosum, or corpus cavernosum, you have the glans penis, you have that skin. What's that skin that's on top? The prepuce. And that's good for this pathway of sperm. But some other things that we can know, this is that fibrocartilage similarly found in female anatomy. Fibrocartilage connects the os coxae, called the symphysis pubis. The symphysis pubis. We also have the perineum, as we said before, the space between the start of, or the back of the scrotum all the way to the anus. Now anus, rectum, sigmoid colon, bladder. I think that's about everything. Okay. This is actually a really great model. Now, it is a small model, but since it is that great of a model, I had to take a good picture of it. You have the frenulum, you have the glans penis, you have the corpus spongiosum and the corpora cavernosa. You have the urethra passing right through the corpus spongiosum. That's a great question. That is a great question to ask. What's the name of this structure? And that's the urethra going through. This would be the shaft of the penis. Dorsal vein, if you go over that. Okay. Now going on to my favorite, the heart. I absolutely love the heart. Everything to do with the heart. I heart the heart. Everything to do with the heart, I absolutely adore. First couple of things that you should know. I have a little way to remember the vessels. R-A away. R-A away. Red arteries carry blood away from the heart. R-A away. Red arteries carry blood away from the heart. I think that sounds like a superhero. If you've ever seen like, what is it, Wonder Dog, I think it was like up, up and away, right? Or so I hear R-A away. So R-A away. Red arteries carry blood away from the heart. Blue veins carry blood to the heart. BV2. I think it sounds like a bad boy band. What BV2, y'all? What's up? Blue veins carry blood to the heart. BV2. Y'all? Now, as a little asterisk, I want to make sure that you understand there is an exception. The one exception to my BV2 RAOA rule is the pulmonary artery and the pulmonary vein. The one exception to my rule is the pulmonary artery and the pulmonary vein. The way that we think about this, the artery still carries blood away from the heart. When it's red, it's oxygenated. When it's blue, it's deoxygenated. Well, this particular artery carries blood away from the heart to the lungs. And since it carries it to the lungs, it does not have oxygen yet. So that's why when we look at our pulmonary artery, it's blue, because it's deoxygenated. And when we look at our pulmonary veins, the pulmonary veins are red because they are oxygenated. Do they still carry blood to the heart? Yeah. It's just it's not BV2 because this is the one exception. When we're talking about the heart, umbilical arteries and umbilical veins work the same way. They have that exception. But when we're talking about the heart, pulmonary artery is this blue, big artery, and pulmonary veins are these big or smaller red veins. We know that this big red artery is called the aorta. The aorta goes up like an arch. We have the part that goes up is called ascending aorta. The part that makes a round is the aortic arch. Ascending aorta, aortic arch. Then as it goes down, it's called descending aorta. Okay. We already said this big blue vessel. The first part is called the trunk. Whenever we hear the word trunk, we're thinking like a tree, and how a tree has a whole bunch of branches and it goes into one trunk. The tree has a whole bunch, this is my impression of a tree, right? Branches going into a trunk. So this is how it works. You have the pulmonary trunk and it branches into right and left pulmonary arteries. Pulmonary trunk going into left and right pulmonary arteries. This big blue vessel, well, blue, we're already thinking what? Vein, BV2, right? So this big blue vein is called the superior, because it's on top, vena, because it's a vein, cava. Superior vena cava. And now if I look on the opposite side, I have this blue area that's on the bottom. It's actually called the inferior vena cava. Now, as a little side note, the aorta, biggest artery, so vena cava, biggest vein. We look right along the same side that these pulmonary arteries are going to be. We have these red vessels called pulmonary veins. Remember, that was one of our exceptions. They have to be red because they're getting oxygen and bringing it to the heart. So these red vessels, you have left and right pulmonary veins. Left and right on the opposite side, pulmonary veins. Coming down, you have your left coronary artery. You think when someone says, oh man, I almost had a coronary. I mean, like a heart attack? Well, a coronary is basically the big artery that's going to supply blood to the heart. One of the big arteries are going to supply blood to the heart. So when they say coronary, that's what they're talking about. Going down to the anterior. Anterior means front ventricular artery. Well, as we'll see, atrium on top, ventricles on the bottom. Anterior ventricular, because it's going along the ventricle artery. On the front side of the ventricle. Anterior ventricular artery. This part right here is called the apex of the heart. Anytime that you have something that's going to a point, that's considered an apex. Like an apex of a mountain, the point of a mountain, this is the apex of the heart. Following along the side of the anterior ventricular artery, we have this great cardiac vein right here. Now, if we're going to go inside, we know that these over here, they'll call them auricles for the outside, this flap thing on the outside, they call the auricles, and the chambers they'll call atrium. So these are auricles, right and left, and then you have right and left ventricles. Best way to see that, open up our heart. I just did open heart surgery. He always laughs at my jokes. I like him. So we have our right atrium, where the superior and inferior vena cava enter in. We have our left atrium, where your right and left veins, pulmonary veins, will enter. We have our right ventricle, and we have our left ventricle. Notice, this left side is way bigger than this right side. This left side is way bigger than this right side. The reason being, this right side takes blood, and it will go from the right atrium through this tricuspid valve, into a right ventricle. From the right ventricle is going to pass through the pulmonary artery into left and right pulmonary trunk into left and right pulmonary arteries and go to the lungs. That's it. Now from the lungs, it's going to go through these pulmonary veins into the left atrium through something called the bicuspid valve into the left ventricle. Now, this thing right here is way bigger because of the fact that it has to pump blood to the rest of the body. A away, right? A away. Well, one was going to the lungs. The right ventricle is going to the lungs. The left ventricle has to pump to the entire body. So it has to be a bigger muscle so that as it pumps, it can pump a much greater force. So, different parts. We have the right atrium, we have the left atrium. We have the right ventricle, we have the left ventricle. Now, we have these particular valves that are held into place. The way that you tell the difference between tricuspid and bicuspid, I remember tri has an R in it. Tri has an R in it, so what side does it go to?
Right.
The right side. Tricuspid, the R in tri means it goes on the right-hand side. Bicuspid, or it's also known as the mitral valve, would be on the left side. So blood goes from the superior and inferior vena cava into the right atrium. From the right atrium, it passes through the tricuspid valve because it has an R. And what happens is this particular valve works as a pulley mechanism. There's a muscle and it pulls and closes the valve, and as it lets go, it opens up. Pulls, closes the valve, lets go, opens up. As it's pulled, we have something called papillary muscles that are holding on to these particular portions of the valve. As the papillary muscles pull, it closes the valve, allowing no type of movement to go past wherever it's going. Let's say it's going into the atrium. The valve will be closed so that only the atrium fills up. Then the valve will open up. It will go through the ventricle. Once it goes through the ventricle, the tricuspid valve will close again to make sure that no blood flow goes back. Now, these tiny little cords that the papillary muscles are pulling on, the cords that the papillary muscles are pulling on are called chordae tendineae. Think the cords that it's pulling on, chordae tendineae. So right atrium, through the tricuspid valve, that papillary muscle pulls on the chordae tendineae to make that valve close, goes into the right ventricle. From the right ventricle, it's going to go into this trunk called the pulmonary trunk, right? The pulmonary trunk actually has another valve. The valve is different than the bi or tricuspid. It doesn't have these cuspids on it. it actually looks semi-lunar, and they're called semi-lunar valves. They look like half moons. Now, if I show you on here, you'll see it looks like a whole bunch of half moons that make up this particular valve. Now, these half moons, semi-lunar, the one on the pulmonary trunk would be the pulmonary semi-lunar valve. The one on the aorta would be the aortic semi-lunar valve. Two types of semi-lunar valves: pulmonary semi-lunar valve and aortic semi-lunar valve. Pulmonary is on the pulmonary trunk, aortic would be on the aorta. So we went from the right atrium, the superior inferior vena cava went into the right atrium, passed through the tricuspid valve. Those papillary muscles pull on the chordae tendineae to close up that valve, goes into the right ventricle. From the right ventricle, it passes through that pulmonary semi-lunar valve into the pulmonary trunk. Then it goes into right and left pulmonary arteries, where the lungs say, okay, using our oxygen that we took in, we're going to place it into the bloodstream. Now I'm going to put them into right and left pulmonary veins. From right and left pulmonary veins, it goes into the left atrium. From the left atrium, it goes through what valve? The bicuspid valve, or the mitral valve. Once again, those chordae tendineae get pulled by the papillary muscles, close up that valve. Goes into the left ventricle. From the left ventricle, it's going to enter into the aorta, but it has to pass through a semi-lunar valve called the aortic semi-lunar valve. Passes through the aortic semi-lunar valve to the aorta and basically goes to the rest of the body. Yay! Blood flow to the rest of the body. Now, what I did was I went over all of these structures by going over the flow of blood through the heart. That is a good suggestion. When you want to learn the structures of the heart, go over the flow of blood, because it hits almost every major structure needed to know by this heart. Now, the only other thing that I would like to do before I have you guys come along and you guys can play around with these models is go over something that might happen with your professor. Are the branches of the aortic arch. So, if this is the ascending aorta, this is the aortic arch. Coming down would be the descending aorta. You have 3 branches coming off of this aortic arch. The first one will go like that. Now, when we're doing vessels, especially right after the practical, I suggest you go back to chapter 1 and go over those body landmarks, because you will see terms like this. Brachiocephalic artery. Brachiocephalic, brachio means going to the arm, cephalic means going to the head. So one going to the head, one going to the arm, brachiocephalic artery. One going up like this. This is the left common carotid artery, left common carotid artery. And then the final one coming off would be left subclavian. What does sub mean?
Below the.
Below. Clavian means clavicle. Below the clavicle, there's an artery on the left side. Left subclavian artery. These are the three branches coming off of the aortic arch. Brachiocephalic artery, so I'll put my little arrow here. Common carotid and left subclavian artery.